In this video, we will show you how to measure shoulder extension using a goniometer. The shoulder complex consists of 4 joints: the glenohumeral joint, the acromioclavicular joint, the sternoclavicular joint, and the scapulothoracic joint. We can measure the amount of shoulder extension for all 4 joints moving together, or we can isolate the amount of extension due only to the glenohumeral joint. The normal amount of extension for the shoulder complex is between 40 and 60 degrees. The normal amount of extension for the glenohumeral joint is about 20 degrees. To measure shoulder extension, the patient should be lying prone or on their stomach. The physical therapist should be on the same side that is being measured, and the patient turns their head to the opposite side. The elbows should be bent to prevent the biceps from stretching and limiting the motion. The goniometer axis is positioned over the greater tubercle of the humerus. The stationary arm is aligned with the mid-axillary line, and the movable arm is aligned with the midshaft of the humerus. To measure extension at the entire shoulder complex, the therapist should stabilize the trunk while having the patient lift their elbow towards the ceiling. To measure extension at the glenohumeral joint only, the therapist stabilizes the scapula at either the inferior angle or the acromion and coracoid processes. The scapula should not move when measuring extension at the glenohumeral joint. A physical therapist may want to measure shoulder extension if a patient exhibits shoulder weakness, has a limited range of motion and screening, or has limited upper extremity function. Contraindications for measuring shoulder extension include dislocation or an unhealed fracture near the shoulder, if a patient is immediately post-surgery or has had a traumatic injury, if a patient has regions of osteoporosis or bony fragility near the shoulder. Also contraindicated are patients with hemophilia and patients with bony ankylosis. When a patient nears the end of the range of motion, the therapist will feel what is called a firm end feel, because most of the structures stopping motion are either muscles or ligaments. These include the anterior glenohumeral joint capsule, the coracohumeral ligament, the pectoralis major, the anterior deltoid, the coracobrachialis, the sternoclavicular capsule, the sternoclavicular ligaments, and the serratus anterior. Researchers have investigated the psychometric properties of measuring shoulder extension using a goniometer. The researchers have shown that there's good intra-rater reliability and validity for this test. This means that if a physical therapist measures shoulder extension and then remeasures shoulder extension at a later time, there will be good agreement between both measurements, with little error. However, researchers have also shown that the inter-rater reliability is very poor for this test. This means that if one physical therapist measures shoulder extension in a patient, and another physical therapist measures shoulder extension in the same patient, there is a large margin of error between the physical therapists. This slide provides a list of references and further readings that have been used throughout this presentation. Now, we will demonstrate how to measure shoulder extension using a goniometer.
Alright, Steve, for this next part, I'm going to measure how well your shoulder moves, and I'm going to use this goniometer to get an angle of how far back I can get your shoulder to go, and that'll just help me to see how I should proceed with your treatment, okay? So what I want you to do next is I'd like you to remove your shirt so I can get a full visual of your shoulder while I'm taking measurements, and if you can go ahead and lay on your stomach, and I'll have you face away towards the windows. And I'll also have you just keep your palms at your side and relaxed. Alright, Steve, so now that I've got you in the correct position on your stomach and with your head facing away and your palm facing your side, I'm going to go ahead and have you extend your shoulder. So what I want you to do is you can go ahead and take your arm off the table, and you can bend your elbow as much as you like during this motion, because we don't want the biceps tendon to limit any motion in this direction. So go ahead, and I'm going to stabilize on your back, and since this is shoulder complex motion, you can be using the complex of your shoulder blade and your collarbone and your shoulder joint to extend your arm upward toward the ceiling as far as you can go. So go ahead and show me how far you can get that to go. Up, and don't let your shoulder come off the table right here. So, good. And now this time if you can just relax into my hand, and I'll go ahead and do the motion for you just to show you the direction I want it to go. So just like that. Alright, until you start to feel tightness. And this time I'm going to go ahead and take a measurement with my goniometer. So I'm going to line up the axis of the goniometer with the greater tubercle of the humerus. So I'm going to palpate for that right there and line that up. And I'm going to take my stationary arm and line it up with the mid-axillary line of the thorax, so just right down the center of your body. And then I'll line up the moving arm, with your humerus, midline of your arm, and I can check that I have the correct line up with that by palpating for the lateral epicondyle of the humerus. So right about there is where I'll be keeping my moving arm. So if you can go ahead and do the motion on your own this time, and I'll measure that. Alright, so with the goniometer still lined up, I get a measurement of 36 degrees. And for shoulder complex extension, we typically would expect about 40 to 60 degrees. So maybe a little limited, but pretty close to normal range for that. Okay, Steve, so this time I'm going to do the same measurement that you just did on your own. I'm going to do it for you. So if you'll just relax your arm into my hand, and I'm going to line up my goniometer the same way that I did for the active range of motion test. And I'm going to be watching for any trunk movement, and that's when I'll stop and take the measurement. So I'm going to lift up your arm. So there I get 40 degrees of motion, which is just about equal to the passive range of motion of 38. Okay, so this time I'm going to move on to looking at your glenohumeral extension. So in this movement, I want to take out the motion of your shoulder blade and your clavicle collarbone. So this time I'm going to be palpating right at the inferior angle of the scapula. So right when that starts to move up, that would mean that there's some shoulder complex extension going on too. So I want to stop the motion there. So if you can go ahead and take your arm off the table and just do the motion we've been doing before and stop right there. So that's the end motion of your glenohumeral extension. So this time I'm going to do it for you. So if you can just relax your arm, and I'll show you the motion I want for this movement. It's like right there I feel the inferior angle start to pop up. So this time I'll have you repeat the motion, and I'm going to be taking the measurement. So same axis at the greater tubercle of the humerus, and stationary arm lined up with the mid-axillary line of the thorax, and my movable arm aligned with the lateral epicondyle of the humerus to get the midline of the humerus. So if you can go ahead and do that motion for me, you can stop, go back down, and I'll just have you do it again. Go ahead, right there. I'm going to take that. Alright, so I get 12 degrees of active glenohumeral extension. So this time I'm going to measure it, doing it passively for you, so I can just relax. And I'll line up my goniometer. Alright. Just relax your weight until, there you go. Right there. Okay, I get 16 degrees of passive motion, and the normal value that you'd expect for glenohumeral extension is 20 degrees of motion.